Some of the women who undergo surrogacy have a feeling of guilt during the process of surrogacy and again after the handovering of the baby. The guilt varies with the type of surrogacy that one offers. In situations where there is a genetic component involved, the guilt is much more. A sample study was conducted about the experiences of the surrogate mother during and after relinquishing the child. In this study, 32% experienced some difficulties in the week following handover and the rest has no difficulty. When 86% non-surrogate mothers feel special bond with the child only. 30% of unknown surrogate mothers feel special bond with the child. What about outcome of children following surrogacy? Following surrogacy, the children are born have a normal birth weight as any other child. Their preterm delivery rate is equivalent or slightly lesser than other IVF pregnancies. Their hypertension and diabetes during pregnancy was less. There was a lesser incidence of a cesarean section compared to an IVF group and a lesser incidence of premature delivery. Whatever studies they were done for follow-up of the children after surrogacy, the data that is available at present does not show any increased chromosomal abnormalities. How does it feel to be a surrogate child? Well, there's a website called The Son of a Surrogate, in which one of the quotation I reproduce is, quote, "Well, I'm here to remind you of the mess you left when you went away. It's not fair to deny me of the cross I bear that you gave to me, you ought to know," quote, unquote. One critical issue that has not happened and is waiting to happen is, what about a child from a surrogacy pregnancy having a chromosome abnormality or a physical deformity? Does the surrogate mother has a right to terminate the pregnancy, or does she does not have a right to terminate the pregnancy? Similarly, when a baby is born with multiple malformations and the couple refuse to take the baby, what happens to that child? As on the moment, luckily nothing has happened on that sort, but it's question of little time the same event can happen, and it is at that point of time a major social crisis can come of defining the rights of the unborn child. What about disclosure of the child? 90% of the genetic surrogate mothers feel that the child should know the facts of who was the basic genetic mother of the couple. But when it comes to a non-genetic surrogate mother, only 60% of them feel the child should know. The rest of them remain uncertain whether it should be told to the couple, to the child, and whether, if it is told, who owns the genetic material. What about the welfare of the surrogate baby? As I mentioned earlier in the talk, we personally feel the priorities are, the priority of the unborn child comes first, then it follows by the surrogate, and third is the actual patient. When an obstetrician is confronted or comes across a situation to decide his priorities, it becomes a difficult issue unless he clarifies his own conscience about whom he is taking care, whether the surrogate as a pregnant woman or the genetic owner as a client. At this moment, the lines are very grey. What about the attitude of the public? In the years when donor insemination has come in the 1950s, similarly when IVF has come in 1978, and in the 80s the oocyte donation and the surrogacy, and in the 90s the ICSI. At each time there was a turmoil with the technology, but finally nothing could prevent the advancement of the technology. It's here the religious, the political, and the socio-economic views are expressed to lead to and to further the complicate the matter. Many people try to take the advantage of the situation and try to impose their opinions, but it's up to the doctors and the patients to come forward and become more responsible in trying to do or not to do a surrogacy in a given situation. The role of press plays a major role in the thinking of the couple and the public alike. In the New York Times magazine, you see a cover story named Her Body, My Baby. Similarly, in a Newsweek cover story, which titles to say Womb for Rent, the complex world of science of surrogacy and mothers. Both of them emphasize the key concepts that are involved in surrogacy and to a certain extent glorify them as a revolution of technology, and to a little extent they have raised the moral and ethical issues that are involved in the process of surrogacy in these two articles that were published. In India, in the Hindustan Times, recently, a couple of months back, we had Israel gay couple coming to the city and become dads. Here, after the advent of giving the rights for the gay couple to marry, the issue of surrogacy becomes all the more important. And here we have a problem where two men who got married had opted for a surrogacy and then had a child. What is the psychological impact for the child born out of surrogacy in this couple? And we fail to look at the rights of the child, and most of the time we're looking at the fulfillment of love and affection between the married gay couple. In a recent Supreme Court judgment, the Supreme Court has said surrogacy is legalized, but at the same time it's becoming compromised. Here in a New York Times, you see the police chief pleads guilty in a surrogate case. Here in the New York Times, you have a headline saying, Second Chief pleads guilty in a surrogacy case. In an opinion that was published in the New York Times, an editorial observer says, a legal puzzle. Can a baby have three biological parents? Similarly, in New York Times, USA, published in December 2009, a New Jersey judge calls surrogate legal mother of the twins. A New Jersey judge has ruled that a gestational surrogate who gave birth to twins is the legal mother, even though she is not genetically related to them. As you have seen in the 3 or 4 newspaper headings, we have wide variety of opinions by the judiciary fraternity, in which the judge has said the surrogate can be a legal mother. In a second situation, the involvement of police in the division of the child is also raising ethical questions where no clear-cut guidelines are there how to manage and who is the rightful parent. Can we bring the change in public attitude? Yes, we can to a certain extent by highlighting the opinions of the key players who are actually involved in the process, that is the doctor, the surrogate and the commissioning couple, and last but not the least, the opinions of the children who have become adults now born out of surrogacy. They are the ones who can really voice their opinion and tell how they feel about surrogacy and should surrogacy be allowed or banned. By advocating the opinions of these three groups of people, we will be able to have clarity in the area of surrogacy and in the area of public attitude.